There's a new device for tinnitus that lots of people are talking about, and it's currently in stealth mode going under the name of the Michigan Tinnitus device. It was created by famous tinnitus researcher Dr. Susan Shore and her lab. People are clamoring to get their hands on one, but it's not yet available to the public. So how excited should you be about this device if you have tinnitus? I'm going to go through the research and share my own expertise to find out. First, what exactly is the Michigan Tinnitus device? This device has a box or a piece of hardware that is connected to wires, and each of those wires have a small electrode. One of them goes on the cheek, one of them goes on the neck. At the same time, there's an earbud that goes inside of the ear, and the specific mechanism of the Michigan device is that you have simultaneously auditory clicks or sounds coming in through your ear and the earbud. At the same time, you have some mild electrical pulses that can be just barely felt, if not felt at all, on the cheek and the neck. And the synchrony and the timing of how the auditory and the somatosensory information is played together is part of the theory and the reason for how this device actually works. If you were to try this device, for example, you would go into a professional clinic and you would sit down in a chair and you would be administered a session where you would sit down, relax, you don't have to do anything actively, and you hear the clicking sound and you feel the stimulation on your cheek. After the session is done, then you go home. And essentially you would repeat a number of these sessions over a treatment period by a professional like an audiologist. This device uses the theory of bi-modal stimulation, which literally means applying a stimulus in two different ways. Why would bimodal stimulation possibly help tinnitus? Well, research has shown that parts of the auditory brain network can respond well to a simultaneous activation of another nerve signal. The brain is trying to understand, is tinnitus an actual threat because it's responding to it like so, or is it something that the brain can just filter out and put less in our awareness, less in our attention? Additionally, certain auditory brain neurons that are very active with tinnitus, they can be retrained so that when we measure them over a treatment period, the activation of those cells can be significantly less over time. Bimodal stimulation, and really any tinnitus treatment, is aimed to steer damaged nerve cells back to normal activity. Bimodal stimulation has different devices that are being researched for this. People are particularly excited about this device with Dr. Susan Shore's lab because of who is leading the research team. And Dr. Shore has a well-known reputation. Over the last 10 years, the team at her lab has been deeply involved in researching how multisensory systems impact the way that we process sounds. They've made a significant discovery, finding that neurons sensitive to touch, particularly those receiving signals from the face and the head, extend their neural connections to the auditory system. These connections end up in the brain's primary auditory processing center, the cochlear nucleus, which directly gets signals from the cochlea, the hearing organ. The findings from Dr. Shore's lab indicate that these touch-responsive or somatosensory neurons have the ability to modify the cochlear nucleus as it reacts to auditory stimuli. Dr. Shore's previous research has shown that in animals with tinnitus symptoms, as determined through behavioral testing in a controlled lab, found that the primary change observed in the auditory brain began with stimulation from the somatosensory system. Therefore, their efforts have been focused on developing treatment methods that involved targeted stimulation, which could potentially reduce tinnitus in some cases, but especially for those with tinnitus due to somatic causes. Taking their general focus and the theory aside for a moment, let's look specifically at the actual science from the most recently published study earlier this year, which took 99 participants to see if the device studied could be used to reduce their tinnitus. In this study by Dr. Shore's lab, people use a special device at home to get a treatment that combines sound and touch. One group used this treatment for 30 minutes every day for 6 weeks, and then took a break for another 6 weeks, and then switched to a sound-only treatment with another 6-week break. The other group started with the sound-only treatment, took a break, and then switched to the combined sound and touch treatment, followed by another break. Right off the bat, we need to understand the study size. Having 99 participants is a relatively small sample size in the medical research community. However, for tinnitus and for audiology, it's to a significant degree where we can analyze the findings together. This was an important first step in their research, but it needs to be followed up by larger studies. I in fact had a patient who worked with Treble Health who saw a notification with the University of Michigan and responded to a research trial and ended up being in this research of going in and doing the sessions and monitoring it to see if it changed their tinnitus. Here's what's great about this study. It was a double-blind, crossover, single-center, randomized clinical trial. In relationship to poor design studies without control groups, the Susan Shore team here in this study clearly went above and beyond and performed an excellent research study. So you're probably wondering, does it actually work, Dr. Ben? And the answer is yes, but there are some caveats. This program is designed only for a type of ear ringing called somatic tinnitus, which we'll touch on that in just a bit. An important metric from this study is that 53% of individuals saw a clinically significant reduction in their tinnitus, which means that if you were in this study with somatic tinnitus, you had essentially a coin's flip of whether this would help you or not. But compared to the other existing treatments for somatic tinnitus, this is certainly worth our time exploring. Just to give some context to the percentage of people that got better, at Treble Health, for example, we aim for an 85% clinically significant change for all of our patients that come see us, and a subset of those have somatic tinnitus as the root cause of their condition. So having a 50% improvement rate in this early stage of research, as they're still refining their methods and trying to better optimize the approach, it's not bad, and it encourages further research and does give a lot of hope to those with tinnitus caused by somatosensory factors. How did the researchers determine success? Well, one of the measures of how participants were ranked was on the Tinnitus Functional Index scale. So the TFI is currently the most comprehensive way to measure tinnitus, and it's recommended by medical researchers, those who are studying tinnitus. It's used by our team at Treble Health. And for example, we want to see at least a 13-point reduction in this score for it to be considered clinically significant. Anything less than that could just be week-to-week variation. It doesn't mean much. But if it's more than 13 points, then we know this patient is getting real help and those results are likely to last. The research from Dr. Shore's lab showed that the average TFI reduction at week 6 was 12 points, and at 3 months was 14 points. So clinically, this means that on average, people are showing improvements at the 3 months mark for those who had somatic tinnitus enrolled in the study. Now, 50% of them did have significant improvement, about 50% did not. So the average score here isn't that impressive, but for the 50% who did get better, the impact was significant, and likely some of those scores were even down by 30, 40, 50 points, which we see at Treble Health as well. Some folks have quite a dramatic swing in tinnitus if we can get the right treatment for their root cause. How does Dr. Shore's research showing a 14-point reduction at the 3-month mark for patients enrolled in her study compared to other treatments like Neuromod's Linear or tinnitus retraining therapy with Treble Health? In 2022, Neuromod released a study that showed that on average for hundreds of individuals who tried the Linear device, which is tongue stimulation, that the average reduction in the TFI score was 15 points, which is significant, not too much different than Dr. Shore's lab. We also measured patients who worked with Treble Health in our telehealth program, and an internal study in 2023 found that the average tinnitus reduction was 20 points for hundreds of individuals. So just from this data alone, if we're comparing apples to apples at the 3-month mark, the Treble Health outcomes are better than Linear Neuromod, and they're better than Dr. Susan Shore's lab. Now, we have to take in mind the scientific approach here and the peer-reviewed studies. So the Dr. Shore's lab is the best research design, and it had the peer review factor as well. The Neuromod Linear research was an okay design in my opinion, and it had peer-reviewed research and it was published. The Treble Health data is internal, so it's not yet published, and I want to be as transparent about that as possible to ultimately get you help and get you relief. One really exciting finding though, that was not about the TFI scale with the Dr. Shore study, which measures tinnitus impact. It was that Dr. Shore's lab was able to measure the loudness of one's tinnitus. What this means is that certain tests that are pretty labor intensive and happen in person in a clinic are able to measure the estimated loudness of a patient's tinnitus. In fact, research has shown that loudness of tinnitus is surprisingly soft when we measure it in a quiet room. But it's the comparative factor that, because it's always there and because we're often in quiet places, that the tinnitus becomes sort of dominating and we can't let it go out of our concentration or attention. But this was studied previously where the average tinnitus volume was just about 5 decibels over someone's threshold, so not actually that loud. In Dr. Shore's research, however, they measured the change of the subjective loudness as it was measured in this audio booth with specialized equipment. And those results appeared good so far, showing volume reduction greater than 6 decibels, especially due to the fact that somatic tinnitus is a very underserved population. These results are very encouraging. All right, so here's the kicker. There's one very important thing to understand about this study if you're wondering if it could be helpful for your tinnitus. This study was only done on people with somatic, also called somatosensory tinnitus. Somatic tinnitus is a type of tinnitus that has a root cause most commonly related to the TMJ, jaw, or neck conditions. Sometimes dental procedures can also cause it. There's other factors as well that can cause somatic tinnitus. A specialized audiologist or ENT physician can diagnose the root cause of your tinnitus, which is essential for you to have a proper treatment and eventually recover from this condition. My colleague and friend, Dr. Michael Gollenhofen, who I interviewed on a podcast here at Treble Health, he shared with us his research, which found the 3 most common causes of tinnitus. They are: first, cochlear, related to hearing loss and the hearing organ; second, somatic or somatosensory, related to the neck, jaw, TMJ, other related conditions; and third, stress-induced or extra energy on the central nervous system. What this means is that a proper diagnosis and speaking with a specialist to identify the root cause of your tinnitus is essential to have an effective treatment plan in place. And if you've been to a doctor who said, yeah, you have tinnitus, there's not much you can do about it, that is a very general and, in my opinion, bad response to the issue. So if you've met with a specialized audiologist or ENT physician who has confidently diagnosed you with somatic or somatosensory caused tinnitus, then there is a path forward. And Dr. Susan Shore's research and the specific device that they're studying could potentially be helpful down the road. If you don't have somatic tinnitus, I would say at this time, this product that you're learning about, this research, is unlikely to help you, but more research has to be done to be sure, because the origin of tinnitus is complex. It's not a one-size-fits-all. Having the proper diagnosis is essential, and the most effective treatments are ones that target the root cause of your tinnitus. If you're interested in bi-modal stimulation for tinnitus, as there are currently other devices on the market, I would highly advise that you meet with a specialized audiologist who can assess your case. You don't want to spend months going down the wrong path after you are trying things on your own, but in fact, they might not actually be what you need. Here's Tamara, who experienced significant somatic tinnitus. It was overwhelming for her. She wasn't able to work. She had to stay home. The sound was unbearable. She went to multiple doctors who failed to recommend a specific program for her tinnitus. Fortunately, she reached out to my team at Treble Health. Even though she had somatic tinnitus, a combination of sound therapy devices, getting paired with an expert on our team, and somatic-based therapies did wonders for her. She worked with Dr. Tracy Peck Holcomb, who was able to help her dramatically reduce her tinnitus over time. And we have experts on our team that practice this every day. Tamara said, "Treble Health has been instrumental in my tinnitus journey. My audiologist that I worked with saved me. If you have tinnitus, this is exactly where you need to be. You're in the right place." At the end of the day, many people would likely benefit more from tinnitus retraining therapy than what they're trying to do right now or what other doctors have suggested. And at Treble Health, we offer that program in a comprehensive manner that's convenient via telehealth. If you're interested in getting advice from our team, everything at Treble Health starts with a complimentary telehealth consultation where you can speak with an audiologist like me, and we can recommend a treatment plan for your specific case. To learn more, give us a call to schedule a consultation. We have people standing by ready to help. Also, you can take the tinnitus quiz to learn more about your symptoms, and both of those links can be found below. So guys, I see it every day in my work that resilience and determination are rewarded. Don't give up if you have bothersome tinnitus. You can and will live a full and productive life, and we're here to help you do just that.